Hi, I'm Dr. Whitcomb, and today I'd like to talk about what it's like to come to my office, what you should expect when you get there, and I'll tell a little bit about uh, what we're going to do, what it looks like, those type of things. First of all, I'm in Nevada City, California. Almost all of my patients will fly in from other states or countries, and we've been treating patients now for 20 years. Thousands of patients have become well. We're really, really excited about all that. So when you get here, it is one of the greatest, most beautiful places you've ever been. Quaint little city, an old gold mining town, and cedar trees and pines and oaks, and it's about 2,500-foot elevation. We don't have all the big problems we had with snow when we were up in Lake Tahoe. So one of the first things we do, obviously, when you come in, we'll have you fill out some documents. Please don't get a little frustrated with that because these documents all go into studies that we do, and we don't exclude people from the studies. Everybody's included. So when you look at our studies and the documents and everything, this is everybody, who came in from the beginning of that study to the end of that study, and you can look up the studies here on the site as well. We have a consultation. I'll sit down and talk to you, trying to figure out what's going on, what you've been through, so I get to know you a little bit better. Also helps me figure out about how long you might be under care. I mean, if you've been sick for 30 years, you're not going to get well in 2 days, that type of thing. We have a test. One of the first things after we do our case history and our examinations is we perform a test. And this test is made to decompress the area that causes fibromyalgia. And the symptoms typically for most people become 50 to 100% better. They might just disappear completely. Maybe they're 25% or 55%. Everyone's different, and the severity of your case might affect also how that responds. And then after we've seen that you respond to the test, because if you don't respond to the test, you're probably not going to get well, and we probably won't accept you as a patient unless you see that big difference. So you're going to tell me if the symptoms went away or if they got better. And you're the one who determines this. I'm not telling you that this is what it is, and I'm going to treat you and charge you this and just accept you into care. You actually know whether or not it helps. And if you go, well, I don't know if it really helped, that probably doesn't help. It's dramatic. The change is dramatic. And when it helps, then what I do is I look and I see how long does it stay gone. If the symptoms stay gone for 5 minutes, you're probably going to be under some pretty intensive care. If they stay gone for 3 days, I don't need to see you as often, and you'll get well faster. So that's kind of how that works. A little bit of professional wisdom in there also, but it gives me a real good indication. So I can tell you, say, look, this is a really severe case. You've been at home for 30 years, taking heavy medications. You're sick. It only lasted for 5 minutes. I'm going to be seeing you 3 times a day. Or maybe it's the opposite. Maybe I'm seeing you 3 times a week. It all depends on what happens with the test. The other thing you can expect to see people probably from other states and other countries. This is quite common in our office. Almost everybody comes in from somewhere else. We have deals set up with different hotels, so you have a place to stay at a good rate, that type of thing. Next, our treatment. I am so happy to announce I've been accepted and qualified to be licensed by a holistic organization, and I'm practicing now as a holistic practitioner. I think it's a great upgrade. I practiced as a chiropractor for 32 years. I'm really happy with that. This is a better fit for what I do, and I'm really excited about that. So the work I'm doing doesn't require cracking your neck and being real rough with you, and I have some nice, easy techniques that work just as well, probably better. And we're able to get people well gently now. It doesn't take as much as much. We used to be pretty aggressive with our treatment. We found out that it actually, if you're a little more gentle and take a little better care of the fibromyalgia patients, they actually do better. We used to also start adjusting the whole back, and we had so many problems with flare-ups and people having problems that we realized that that just didn't work. And so our work is primarily done with different types of trigger point therapy and pressure techniques that are awesome and work really well. So the care in the office is relatively painless, and typically, if you are in a wheelchair, within the first week or two, you're walking. That's kind of average. Some people take longer, have had bigger problems. If you're having convulsions, they normally stop the first week. If you're fainting, sometimes that takes a little longer. Some of our patients actually faint after the treatment. So I've had a couple of them one that would faint every time I'd work on her. She'd go out, sit down in her chair, pass out. All the other patients were there and they'd look after her. She'd only be out for maybe 15 seconds. And she'd wake up going, I can't believe how good I feel. I had another patient who we had to wheelchair to her car because she'd pass out after the treatments. We had to watch her, make sure she didn't fall down. But both of those responded extremely well to treatment, and that was just the way their body responded to it. Wasn't anything dangerous. And but passing out is a real common thing for fibromyalgia patients. A lot of them pass out, fall, hurt themselves. It's a terrible thing. So it's really good if we can able to get that under control relatively early, and typically it gets under control very early. A lot of our patients have really very bizarre and difficult situations, and during the first part of the care, people are generally anxious, they're not sleeping, they don't feel good, they've got fibromyalgia. They'll normally in the first week or two start seeing the symptoms let up, start feeling better. The real big change typically takes place around the fifth, when the sympathetic nervous system shuts down and they start sleeping again. Once they start sleeping again, they'll typically 10, 12, 14 hours a day, they're sleeping and they're feeling horrible because they're so tired. Within a week, they've got the sleep deprivation under control and they're feeling great. They've got more energy than they felt in a long time. The pain is a lot better. They're out walking, hiking, increasing their walking. And as our treatment goes on, most of the pain is gone for most people around the fifth week. This is, my observation. And also I have documents to show that. And then by the time they're, here a couple months, they're walking 4 to 5. You'll be walking 4 to 5 miles a day. This is something that I require. And not if you're sick. If you're too sick to walk, you're not going to walk. But if you've got great energy and you feel great, I want you out there walking. And that walking takes place after you respond, not before. The walking doesn't get you well. The walking will make you sicker if you try that before. So we very gently. And then when you are about 80 to for 2 weeks, go home, we educate you, and hopefully, someone who's very close to you on things that will help relapse. Rather actually remember work on these things than have a professional work on you, because most of the time professionals, I hate to say it, but we're all arrogant. And we think, well, I can do that better than Dr. Whitcomb. And then they hurt my patients, and my patients are back, or they can't get back and they're sick again. So we would prefer that you actually do some of these things at home. And there's things that you can do at home. So that is kind of what it looks like. You'll make a lot of friends. You'll find people from other states and countries here. I'm an older guy now. I've been off for a few years. My wife passed away 4 years ago. I've taken some time off, take care of her, and kind of recuperate myself as well. So I'm back. I'm going to keep my practice relatively small and take a limited number of patients, just because I'm kind of at that time in my life, but I want to help people. So feel free to call me. you can contact me here. Be sure and subscribe. I really appreciate that, and like it. It helps the message get out to other people. And this is my mission. I've been doing this for a long time, and you still don't hear about it as much as you should, because it's just hard to get the word out. And the more it seems like the more public I get, the more I get beat up. So it's difficult. But I promise you, we work as hard as we can at getting people well, and we now have thousands of people well. So thank you so much for watching and for listening, and please let other people know so we can reach them too. I really appreciate it. Thank you.